Welcome, everybody. We're so thrilled to have you joining us for our next webinar. This is an invited panel on challenges and opportunities to address the needs of youth using digital mental health. We have an amazing lineup of panelists here and thrilled to have them joining us. So I want to introduce Dr. Kat Boger, who is a board-certified child and adolescent clinical psychologist who has really devoted her career to helping children and teens with anxiety disorders and OCD. In 2013, she co-developed the McLean Anxiety Mastery Program at McLean Hospital, which is nationally recognized for providing empirically supportive intensive anxiety and OCD treatment. She also served as an assistant professor in psychology at Harvard Medical School and has published many peer-reviewed journal articles, delivered many regional and national talks, and provided training to hospitals and schools. And she is the author of a children's book, Step by Step, about facing fears and being brave. And in 2021, Dr. Boger co-founded InStride Health with the mission of increasing access to insurance-backed, research-backed care for children, adolescents, and young adults with anxiety and OCD. Welcome.
Thanks. So glad to be here.
Also very excited to have Dr. Margaret Anton with us. She is a senior manager on the clinical innovation and research team at Two Chairs. She received her doctorate in child clinical psychology from the University of North Carolina at Chapel Hill and completed her clinical internship and postdoc training at the Medical University of South Carolina. For more than a decade, Dr. Anton has developed, evaluated, and implemented technology-enabled behavioral interventions in academic, community, and industry settings. Clinically, she specializes in evidence-based interventions for child trauma and early onset behavior disorders, and also appreciative that she is the industry consultant for thriving youth in a digital environment. Welcome, Margaret.
Thank you.
Also very excited to have Dr. Ali Ünlü, who is an interdisciplinary researcher and policy analyst, specializing in the integration of AI and computational methods into social science to address complex societal issues. His research focuses on AI applications in health analytics, social media analysis, with expertise in identifying risk factors for mental health, substance use, violence, and crime. And he applies natural language processing and network analysis to study public discourse on many topics, such as school shootings, violent offenders with mental health issues, social media bots, hate speech, and youth engagement with social media. And Ali is also involved in advancing AI and machine learning research across teams at University of Virginia. Welcome.
Thank you very much.
And last but definitely not least, Dr. César Escobar-Viera is an assistant professor of psychiatry and director of the Pride IM Lab at the University of Pittsburgh School of Medicine. He is a primary faculty member at the NIH-funded P50 Enhancing Triage and Utilization for Depression and Emergent Suicidality Center, and also holds a secondary appointment in behavioral and community health sciences at the University of Pittsburgh School of Public Health. Dr. Escobar-Viera leverages mixed methods and clinical trials for conducting both observational and intervention studies to better understand the potential benefits and risks of communication technologies and the clinical impact of digital interventions that target social media literacy, online victimization, and youth suicide prevention. Welcome.
Thank you so much.
So thrilled to have you all here. I'll briefly give you just a chance to add anything to the intros that you want to add, maybe noting your connection to this panel topic, and please note any conflicts of interest or other disclosures that you want to at this time. So Kat, I'll start with you.
Yeah, I'll just say I'm really happy to be here, very passionate about pediatric mental health and how to make it more accessible through a combination of human and tech intervention. And my disclosures, I am a co-founder, so I have equity and a salary from InStride Health, and also an advisor to Mira, which is a measurement-based care company. So I have equity in that too.
Fantastic. Margaret.
Very, very excited to be here today. As Bethany mentioned, I am a consultant on the Thriving Youth in a Digital Environment initiative at the University of Virginia, which I was very excited to be invited to because my work for the last few years actually hasn't been in the youth space, both Two Chairs and Able to, where I was prior to that, serve folks 18 and older. So it was really nice for me to reconnect with my roots of building digital interventions. And similar to Kat, I am employed and have equity in Two Chairs.
Wonderful. Ali.
Yeah, I'm also happy to be here today with you. And I'm also one of the conference committee members and happy to contribute as much as possible I could do. As Bethany has already mentioned, I'm an interdisciplinary scholar, and I have been working on youth mental health and behavior for a long time, mainly focusing on substance use, violence, delinquency, and radicalization related topics. And in the last couple of years, I tried to integrate this research on social media and AI-based research. So yeah, thank you very much for this opportunity and get connected with you all.
Fantastic. César.
Thank you. I guess what I would add is that we have a focus on youth in general, but a more specific focus on LGBTQ youth in terms of the interventions that we think of at the lab. And at the moment, I have no interest to disclose.
Fabulous. I want to, going to start with some questions for the panel here, but I also invite our audience members to add your questions to the Q&A, and we'll make sure to save time to try to hit as many of those as we can. So I want to start by asking what you all see as the most exciting advances in addressing the needs of youth using digital mental health interventions. Kat, do you want to start us off?
Sure. Yeah. So there's a lot of excitement on my end going in different directions. I think one of the areas where I'm most excited is about hybrid models. So models that are integrating virtual therapy with between session support. So things like coaching, skills practice, parent guidance. And I think these models combine the best of tech and human connection, and they bridge that implementation gap. And, I think we all see as providers situations where patients can learn the skills, understand the skills, but it's a whole different ballgame to then apply them in real life and have those skills and strategies turn into new habits. We see this all the time with exposure and response prevention, where a therapist will assign an exposure and say, all right, go practice 4 times before the next session. And they come back, how many times did you practice? Well, 0, because anxiety and avoidance go hand in hand. So really thinking about how do we incorporate technology to enhance the learning between sessions. So for example, we have coaches who are digitally engaging with our patients between sessions to really help generalize the learning and make it part of their lives. And I think to what Katie said before, as we're designing these interventions, we really have to think about what is actually going to meet young people where they are and how to best engage them between sessions. So as the tech continues to advance, I think we need to have that feedback loop with youth. I think one other area I'll touch upon that I'm really excited about, also Katie had talked about, is thinking about how we incorporate AI into care, and AI as a complement to care as opposed to replacing real relationships. I think the AMA president had talked about how AI is not going to replace physicians, but physicians who use AI are going to replace those who don't. And so I really think moving forward, we have to think about how are we actively equipping our providers in terms of AI literacy? How are we informing them so that they can be thoughtful and ethically grounded consumers of AI? And I think this entails not just understanding what the tools do, but being able to ask the right questions, to be able to understand limitations, clinical relevance, potential risks. And I think that as AI gets more and more embedded into mental health care, we have to think about clinical expertise differently so that a component of that is digital literacy. And so it's the idea of not just replacing human judgment, but sharpening human judgment with AI.
And what would that look like, the sharpening that you're thinking about, do you think?
Yeah, so we're actively working with our providers on being consumers of AI. And so we're equipping them with the tools and the knowledge and the questions to ask so that when they get AI output, they're not just taking it for granted, but they're feeling responsible for the output. They're asking the right questions. And then we're also thinking about how do we ensure that our providers are not degrading their own expertise and skills with the use of AI. And so if you think about one risk that we have, there are a lot of risks, I think we're all aware, but one big risk is that as providers become increasingly reliant on AI, that then their skills will narrow. So for example, you think about an example of differential diagnosis, and let's say a provider is relying on an AI tool to, when patients come in, to make those diagnoses, and over time becomes more and more reliant, such that then you have a situation like a cyber attack and they can't rely on that tool, and a patient comes in crisis and now they can't diagnose. So how do we think about AI not just like providing, like spitting out the information that providers then go use, but how do we think about AI as a way to educate our providers? And so, for example, one idea is, instead of just spitting out information for them, giving them answers in the form of multiple choice. Or what we do in our clinic is we're piloting an AI tool that will help providers navigate our evidence-based tools. So if they ask a question, it doesn't just to give them the answer, it brings them to the right place in our provider guide so that they can then review the information and make sense of it.
No, that's terrific. Other advances that people are excited about and want to highlight?
I think to both Kat and Katie's point about sort of meeting kids where they are, I think there's just so much neat innovation happening in this space of really leveraging platforms and ways that kids are already using technology to get evidence-based resources into their hands. Like, I know there was a period of time where I believe Harvard was paying influencers and coaching them in evidence-based interventions, and then having them go create content on TikTok to really ensure we know that this is where youth are going for information. So how do we try to upscale that information in ways that's getting the right information into the right places? And I think it's really fun to see us starting to get more creative and thinking outside of the box of, we're never going to probably totally shift youth behavior in terms of how they use technology. So let's figure out how they're using it and how to get them good, accurate content.
No, that sounds great. Ali, you had a point you wanted to raise?
Yeah, in recently there are also lots of data that have been used for intervention projects. So in the baseline model, they have lots of information have been collected, and intervention goes, for example, 4 years. But now with this machine learning models, it's easy to make a risk prediction which children could respond to intervention. So we don't need to wait a couple of years to transfer them to in different intervention settings. That's another good way using these technologies for youth. And also there are lots of new virtual support systems like Sober-Grid that can be used in substance use field. So it's a kind of social network apps connect individuals in recovery so they can find people who are in the similar conditions. Also now there are different applications are introduced within other messaging app like WhatsApp or other thing. So instead of creating a unique chat box out of the system kids using, they develop these systems and embed it in the system they are using. For example, I came across one application in South Korea. They developed the tools in Kakao Talk. So it's a kind of WhatsApp app. So they can communicate and get support when they need it. And I was in SPR conference last week in Seattle. So in many universities, research labs develop new tools to support age-proper mental health tools. So more segmentation is on the way, but in the long term, I think the main challenge will be integrate this academic-driven application with business models.
Well, and that's a great link to our next question. You've each highlighted actually some of the challenges that arise. So I'd be curious to see what you see as the main challenges facing the field in terms of, being able to move forward in advancing evidence-based and well-integrated digital mental health for youth. Margaret, do you want to start us off?
Yeah, absolutely. You know, I think even though we've gotten much better at engaging youth and understanding where they are and trying to meet them where they are, we still continue to have big issues with engagement, and sustained engagement in these tools. So, you know, I see that as a continuing challenge and something that we really need to bring youth voices more to the table and ongoing
Right.
at sort of every stage of implementation to understand what are the challenges to ongoing engagement and also better data on what is optimal engagement with these tools. I think, you know, we've made progress from the time where we sort of took an evidence-based intervention and had a module per session of that intervention, but we still probably are like requiring people to spend too much time in the digital interventions for how people tend to like interacting with their tools. So I would like us to start to better understand, you know, what is meaningful engagement? How do you define that? And then, you know, David and Katie really highlighted challenges with fragmented healthcare system. And I think this is going to be a huge challenge and is probably an even bigger challenge for youth who often aren't in control of where they access their healthcare and how they access it. Um, I think there's a lot of benefit in companies building out individual interventions to make sure they're getting it right. It's hard to build something that works for everyone and for
Right.
everything. But at the same time, we now have lots of different platforms out there with lots of different interventions. And, you know, folks don't often know, like, oh, I have this problem and I need to go to this company for that. So, how can we help people find the right tools at the right moment for them? And then have them be reimbursable and accessible to them.
Yeah, I really appreciate the ways you're highlighting sort of all stages of the dissemination implementation pipeline. And also I think that, you know, it's such an interesting question of like what is the right amount of time or the right dose, and so much depends on which outcome measures we're paying attention to, right? Like so some of our programs want to help people in the moment. Others, you know, may ask people to do an exposure looking at, you know, work that you might be thinking about, Kate, right? To help with that avoidance, which isn't necessarily going to feel great in the moment, but we know is going to help people long term. So I think we have all these questions about timeline and what counts as effective. So yeah, really appreciate you raising those challenges. Other challenges that people want to highlight, and then we'll come back to the sustained engagement one, because I think that's the $1 million or maybe $1 billion, given the size of the industry, question that we're grappling with. But other challenges people want to highlight.
I do. I really agree with Margaret's point about engagement being potentially the biggest challenge that digital interventions face, and it has many sides too, because the question of dosage is key to get good engagement and efficacy, but also the question of how relevant the components of the intervention are to different groups and different youth from different backgrounds, and so that we don't end up developing all these fantastic amount of tools for youth who already have access to a lot of services, to a lot of different type of interventions, and we leave those in vulnerable groups even more vulnerable because now they cannot access offline services and then they cannot access online services either. So I think the question of cultural adaptation of these
Mhm.
interventions is very important. And think about all these different groups that need interventions designed to tailored to their specific realities. People living, youth living in rural areas, youth from different racial and ethnic backgrounds who might have similar challenges, but with different perspectives from their specific ethnicity or racial experience. And finally, LGBTQ youth as well. I think the fact that we are now working with interventions that leverage AI or to some extent uh, should enable us to work through this process of cultural adaptation even faster than before, because like Ali said, that used to take a couple years, if not
Right.
more, to actually adapt an intervention. It should be easier now, and it should be, I think, uh, on the priority, short priority list of things, because having that will help us boost engagement and therefore efficacy as well.
No, I really appreciate the points you're raising. I will say it's been interesting. We've been using AI to personalize some of the training materials for our digital applications. And going back to the points that are being raised, it happens very quickly. It allows for a high level of personalization. And that, as Kat and Margaret and others pointed out, like we need that. It doesn't eliminate the human involvement, because what we've also seen it do is perpetuate some of the biases in the different communities we're trying to serve and reinforce some of the stereotypes in some of the material. So it's kind of like, it's definitely that balance to make sure that it's accomplishing what we want it to. So yeah, I really appreciate people highlighting these different challenges, and particularly those issues tied to disparities. Let me ask you, Cesar, to continue a little bit the piece you started to talk about how we can best engage youth in more sustained ways with these digital interventions, so that we are not just having them initially try, but getting whatever it is, that right dose that they need in order to achieve sustainable gains. What have you seen either in your own team or other teams that's working well to support that?
Well, I think, as Katie and David already addressed in the keynote speaker earlier today, engaging youth throughout absolutely every step of the process, even from coming up with the relevant content that should be included in intervention. One thing that we heard in the assessments that we conducted among youth is that a lot of the times, the interventions that are designed for them seem to constrain to the specific clinical outcome that the investigator or the developer was targeting,
Mm-hmm.
being that depression or suicide prevention or what have you. Um, but one of the factors that lead to this early disconnect with the intervention seems to be that it's too constrained to that particular topic. And they have not just that one question about mental health, they have many others questions as well. Some of them related to healthy relationships, some of them about to how to engage in a
Mm-hmm.
healthy way with technology, with social media. Um, and when a certain intervention uh, doesn't somehow address some of those other questions, then they lose interest quickly. And we heard that repeatedly over time. And so that's why I think engaging youth from the very start of the process, maybe through these advisory boards or maybe these youth collaboratives that we've been working with in my lab, is helpful because it's it opens new research questions that we didn't even think of, potential content that we could add to our interventions, and of course is up to us to figure out how to still evaluate the
Sure.
efficacy or and the feasibility of the intervention. But again, if we do not address these concerns that are related to how they will like the intervention best, then we will not get to the point that we want in terms of developing effective interventions.
No, that's great. So I appreciate you highlighting the importance of kind of really thinking about the whole person, because of course they don't think of themselves as like, I am coming just to talk about this. They're coming to talk about like what's hard in their life or whatever it is that they need. So, and I also appreciate the idea of thinking about what outcomes do youth themselves care about, right? So, we may have our metrics or whatever that we're using, but that may not align well with what they value. These are great suggestions. Let me open it up. Others want to comment on things that they're seeing as really exciting about how to improve sustained engagement.
I can jump in here. When I think about engagement, I think about personalization as some folks were discussing before. And I think with evidence-based treatment, we see pretty consistent response trends at the group level, but at the individual level, we actually see a fair amount of variability. So you could have two kids in the same trial with the same diagnosis, same treatment, but really different outcomes. And that's not necessarily a treatment failure. That's just reality. And I think it's because mental health is inherently nuanced, it's dynamic. And this is where we need to bring technology in to close that gap. And I think it can give us the tools to take something that's evidence-based and broadly effective, like CBT, ERP, behavioral activation, and adapt it, as folks were talking about before, to specific needs and context and background. So instead of saying things like this works on average, it's like, how do we make this intervention work for you today based on your background, based on your age, your interests, your strengths? And I can give you examples of two ways we're doing this at
Yeah, that'd be great.
and credit to an ADAA talk that I went to that gave us some of these ideas. But one is tailoring psychoeducation and CBT concepts to the individual. And so what you can do is put in prompts. So you take material from our evidence-based curricula, put it into to an AI prompt and ask things like, explain SUDS to a child who loves music using this description of SUDS. So it's taking the description you provide, but now you're personalizing it. Or make a list of behavioral activation activities for a 19-year-old who loves nature and the outdoors. So now you're really tailoring this content to what this kid is going to matter to this kid. Or a list of rewards for an 11-year-old who loves Disney and ice cream and soccer. And then you can curate further. So let's say they spit something out and it's all about Toy Story. And you can say, actually, this kid really loves Inside Out. Could you tailor further? And so now it's sort of manualized, it's protocolized, but it's tailored to the individual. And we also do this with exposure planning. So let's say you have a patient who has emetophobia, that's a fear of vomit. What a therapist would then do is make a fear and avoidance hierarchy with all sorts of vomit exposures. You can use AI to get really creative, like this kid loves hip hop, so make a hip hop song about vomit. No, actually, they like country music. Make it a country music song about vomit, or create the best fake vomit mixture for an exposure. Write a poem about vomit, or find movies that are appropriate for, let's say, a 13-year-old, because there are many movies with vomit that are not appropriate for a 13-year-old. With vomit scenes in them. And then you can use those things for exposure.
Fantastic. Yeah, those are great examples. And I love the ways that you're so creatively personalizing. So now I want to raise a kind of different type of challenge, which is, how can you think about this sort of that really complex sort of tension that exists of we're simultaneously trying to help youth manage time and activities online so that they are also engaging in that in person and having a good balance and sleeping and, all those important things, while also simultaneously leveraging technology to support youth. So how do we sort of go about achieving that balance and finding those like healthy ways to engage, minimizing the harmful ones? Ali, let me start with you.
Yeah, so in the educational settings, the digital literacy is one of the main assets, but nowadays algorithmic literacy is going also gain attention, because besides knowing how the online environment works, how people behave online, this is mostly in digital literacy area. But now we are all living in different algorithmically designed platforms, and they enable us to engage more. So training on them how to this algorithm works to increase our engagement, creating filter bubbles, echo chambers, rabbit holes. These are all essential skills. And also we generally talk more about the side effect of technologies, but we also teach them how to use social media or these technologies in positive ways.
Right.
But also we encourage them to find out ethically designed, age-appropriate applications, and then how to engage with those applications in their real life settings. And also, it's still important to emphasize the risk of over-reliance of these AI technologies. So while these are useful, we always need to emphasize that creating more opportunities for physical engagement and interactions in school or after school or with community activities. And this is also another different topic maybe, but the current regulations, particularly in the United States, after the age of 13, everybody regarded as adult. So this could be discussed a bit broader in policy perspective. Now, probably you heard that Austria made some regulations and banned social media use under the age of 16.
Right.
And some EU countries also started this type of initiative. So it shows that, yes, they need to engage with social media or AI tools, but there should be some balance between they become an adult. So these are the main health ways how they can use these technologies with a kind of adult support or adult guidance until certain age. And after that stage, anyway, they can use it in different purposes.
No, thanks for sharing your thoughts on that. And of course, a highly contentious area about, what those regulations should look like, what those age lines should be, all of those kinds of things with people taking very different approaches. So let me open it up to others on the panel to share your thoughts about how you think about that tension and those balances.
I can jump in, and to build off some of the things you were just saying, Ali, I think it's really important to set norms around digital hygiene in the same way that we do around sleep, as you were saying, Bethany, and nutrition, that we need to have some boundaries around tech use. And so I think part of clinical work is helping families set expectations that work for them. So what are their expectations around things like tech downtime or no device zones? But then also striking that balance where we're modeling how we can also use tech for positive mental health. So we'll often talk about helping families help their teen use tech to support in-person interaction. So it's like becomes a stepping stone to interacting live instead of replacing the in-person interactions. I think another theme that we talk a lot about is the meta awareness around tech. So it's going beyond just like limiting screen time and instead helping young people really build their awareness of how they're using digital tools, how they affect their mood, let's say, or their focus or their energy, so that they can then be empowered to self-regulate versus a parent or a caregiver having to regulate for them.
Yeah, preparing them for that greater stages of independence and getting the tools in place. Yeah, 100%. Other perspectives that people want to add to that? All right. Well, we're right on time then to turn to some of our fabulous questions that are coming in from our audience. So first one I want to highlight is, as some panelists have mentioned, there are many digital mental health services with many different options and components. How do providers help clients select the most appropriate service to incorporate into their services? So how do you guys approach choosing what you use and then also what you recommend to families?
I can jump in here. I think that we're always coming back to what is the problem we're trying to solve. So for example, when it comes to AI, we're not going to use AI just for the sake of using AI because there's a lot of hype and it's exciting. We're going to be really deliberate about what are the problems we need to solve and can AI be part of that solution or not. And then I think that as we're identifying the various solutions that are part of our model, that feedback loop is critical. So it's a feedback loop both with patients and families, and then also with our providers. So they feel empowered to be part of the conversations. They're the ones who are on the ground doing this work, so they know best what is working and what's not, and where we have potential risks.
Great. Let me ask a question, Cesar, that came in for you. How do we account for intergenerational differences when it comes to engaging with youth and also thinking about differences tied to attention spans? Oh, you're muted.
Sorry. Thank you for that question. I wasn't sure if they meant about intergenerational differences between youth and adults or older and younger adolescents.
Yeah,
But
I would comment on both of those because I think both are relevant.
well, I mean, in all cases, I think the questions apply to both differences. I mean, it's very important to think about if the intervention is being designed for adolescents from different age groups, to incorporate the voice of those different groups in the development and testing process. So that, for example, if we expect that the tool will be used for maybe 14 years old or 15 years old, not only 18-year-old adolescents or early college students will participate in the development and testing of that tool. So keeping the development process very relevant in terms of cultural development and incorporating the voices of those adolescents is important. Having them being part of the entire co-design process is crucial. And having, for example, um, if the tool is also planned to being used by adults, for example, if that is a question, having maybe adults participating in some form of moderation during these development and testing sessions could be helpful in order to come up with an intervention that can be used for both these groups. And in terms of the attention spans, that the second part of the question, I feel like we always live in this this idea that adolescents have a shorter attention span, which I think is a very dismissive idea in itself. I mean, just the fact that some adolescents spend a lot of time playing these very complex video games sometimes is in itself proof that there's no really short attention span in adolescence. But the point is that there is this selective attention to what seems to be relevant for them. So we have to think about interventions that are designed in a way that seem relevant for them. For example, a lot of the interventions are so heavily reliant on text, and we know that that is the least engaging communication media that we can use. We need to start creating more videos, more voice notes, more imaging or other type of media that are more engaging. We also need to maybe think about these micro interventions that are shorter to use. We need to think about incorporating gamification as well in our interventions so that we can expand this attention span that we would like, depending on the outcome.
No, I appreciate that. And it goes back to Kat's comments on, using songs in all kinds of ways to engage. So we've had a lot of, I think, really fruitful discussion on different ways to engage youth. I want to shift to one of the questions that we have in the Q&A, and thank you to everybody, by the way, who's submitting questions. These are fantastic. There's a question in there for someone who used to work at a youth clinic and talks about sort of how they were using a session-by-session online survey tool for clients. But where they sort of hit some challenges was actually buy-in issues from clinicians. of having them sort of integrate the digital tools into the practice, and that clinicians were viewing them as a burden rather than as a resource. And so, can you talk a little bit about how we can better communicate the value and impact of digital mental health tools in order to foster greater clinician engagement? And of course, we all know the idea of like have a champion in the setting, but let's kind of take it one step further because that's not always getting us all the way there. So, what other thoughts do you have about how to really engage that clinician buy-in? Margaret, do you want to start us off?
Yeah, I'm happy to weigh in. So, at Two Chairs, we require measurement-based care for every session for our providers and our clients. And we went through sort of a standard implementation process of this. And not surprisingly, clinicians felt like it was high burden, weren't seeing a lot of value. And we ended up going through a large re-implementation process where we did the champions and everything that you just said, Bethany, but what seemed to really make the difference was providing lots of decision support and information to our clinicians on how to make use of the information in session in a way that it got woven into the process and fabric of care and provided them something that they weren't able to get without it. So it's hard if you're using an external tool to do that, because you might not be able to layer on your own decision support. But I think it's really understanding what are your pain points for your clinicians as well, and building or selecting a digital tool that fits into what to their workflow and also helps them do something that they wouldn't otherwise be able to do or that they're struggling to do, and providing space and time for them to explore that and really understand how to make use of that information in a valuable way. We often think so much about one end user when we build digital interventions, but there are lots of end users. So I think from like the moment of development to selecting a tool, it's being clear on how you want all users to use it and making sure that they have some say in that as well.
Yeah, I appreciate you highlighting choice at the end there because I think that's so critical is that this idea that there will be the one pathway or the one implementation, whatever it is, or the one, choice is not going to work out very well. So yeah, I appreciate that. Anything that you would add as sort of concrete examples of how you've done that weaving that maybe might not be what people expected or surprised you along the way? Because I think it always helps to like move from the principles to like on the ground, this is what it looks like.
Yeah, so I think our providers were getting a lot of pressure to like get people out of care. I mean, everything is about efficiency right now. But they weren't clear on how to use the data to make decisions around what to do in care, or were feeling stuck if they weren't seeing progress, and they were getting all these alerts like someone's not making progress, and they're like, I know, I feel like I'm hitting my head against a wall too, but what do I do? So we worked really hard to actually layer on manager support and consultation groups. So it's sort of using the tech to alert people that there's something, but then providing them a space to go and where they're able to get the support that they need to figure out what to adjust and then what to pay attention to in the data. The other thing, we were using Alliance as a performance metric, which did not go over super well. And people were feeling a lot of pressure and coaching people on how to answer those things. So we really listened to the clinicians and just sort of said, look, like, we're not going to use this way anymore. You're right. This isn't serving anyone. Here's how we want you to use it instead. And as long as you're doing that, you're fine. So, I think it's listening and providing digital and non-digital supports in ways that really help people get what they need and is addressing problems that they're having every day.
I appreciate it. I feel like you're going full circle here of all these bridges between hybrid models or tech leading to in-person supports. Kat, you wanted to add something there.
I was just going to add, and this may seem like an obvious one, but often we lean in on like the what and the how. And I think what sometimes can get missed in communication and change management with our providers is the why, and really leaning in on that as we think about new digital interventions. And, at InStride, we conceptualize clinical quality as along the lines of the quadruple aim in medicine. So, patient and family clinical outcomes, patient and family engagement, provider engagement, and cost. And so when we're implementing these changes, tying it back to those different elements of quality, I think can really with provider buy-in.
That's great. We just have a minute or so left. I'm sorry we didn't hit all the questions. There are many questions on AI and different clinical pieces. I want to let people know many of these topics are also covered in some of our Ask an Expert sessions and in our networking room. So hang on to your questions so we can have another opportunity. Let me finish with just a quick question about any examples of resources on AI literacy that you are using or have found helpful that you want to share with the audience. That was a first question that came in, so I want to honor the first question getting asked.
I went to a fantastic webinar. I'm going to blank on the name of it, but I could look it up, and, and Bethany, maybe you could share afterward.
Sure.
To support, in just thinking about how to support AI literacy with providers. And so it's led to a lot of conversations with our team. And what we've actually done is created AI pillars. So we're really thinking deliberately as the technology is constantly changing, and we know this is going to be a part of workflows moving forward. We want to be grounded in sort of like what are our fundamental principles for how we think about the what, the why, and the how of AI. And so I do think coming back to those pillars has been helpful for our providers. But we've also, part of our new provider onboarding is an AI literacy new hire training too.
That's great. And I think the who is really important in that equation as well, right? Speaking to that, like diversity of different constituents that we're trying to support. Thank you so much to our amazing panelists for sharing your insights and wisdom. Hopefully there'll be a chance for you to follow up on some of the questions that were asked, and we're happy to share out other resources. But thank you to everybody for joining, and I want to direct everyone now over to the virtual exhibitor hall that will be moderated by Acacia Park. So look forward to continuing to hear all the great conversation. Thank you all.